Hello, this is Mike with Health Agents Network, and today I'm going to share with you Medicare Part D, a working example. This is the same example I use in the field with all my clients. So Medicare Part D can be very confusing, and rather than show them this chart as an example of the Medicare New Book or some other reference point you have from a carrier, it's easier to show them a working Part D example to show how the numbers work throughout the year. So I'm going to share with you what I use in the field. It is not CMS approved, so you cannot leave the illustration you're about to view with the client. But you can write on a piece of paper or in a legal pad like I did and simply take it with you and redo it at the next appointment. I literally had a legal pad with the same diagram over and over again, but I know I couldn't leave it behind, so I just kept redoing the same thing. So here we go. Here's how that working example is illustrated using 2017 numbers. So at the top of the piece of paper, I'd write you and the insurance carrier, and I'd say, Mr. Smith, here's how Part D works. So let's say you have a $20 generic drug and you have a $5 copay. So here's your $5 copay. Your insurance carrier pays $15, and you have your $20 generic drug. So you're going to continue to pay throughout the year your copays, your co-insurance for your drugs. And the insurance carrier is going to pay whatever remainder that is. That's going to keep on going until you reach $3,700. This is your initial coverage limit. Once you hit this number between you and the insurance carrier or total drug cost, you're going to hit the coverage gap or the donut hole, as you may have heard it called, until you reach $4,950. Once you hit this number, you're out of the coverage gap and you only pay 5%. Now you may be thinking to yourself, Mike, that's not so bad. That's a difference of $1,250. Well, you have to remember, the same people that wrote the tax code also designed this plan, so it's not that simple. So ignore that $1,250, because once you hit the initial coverage limit, things change. So to get the initial coverage limit, it counts all the drug costs. Once you hit it, though, it only looks at yours. So to keep numbers nice and round, let's say you spent $1,000 in copays, which you may or may not spend, probably not that high, I don't know. But again, to keep numbers easy, let's say you spent $1,000, and the insurance carrier spent $2,700, equaling your $3,700 initial coverage limit. Medicare is going to ignore that $2,700, and they're going to only look at what you spent out of pocket. So your coverage gap is from your $1,000 to $4,950, or in this case, $3,950. However, you do have some relief, because in 2017, you're going to actually have a discount of 60% and 49% off generic drugs once you hit the coverage gap. So this Part D works with every plan. It's irregardless on who the carrier is or what your copays are. That $3,700 and that $4,950 does not change from carrier to carrier, nor do the gap discounts. So this is how I explain Part D to my clients. Feel free to rewatch this, practice it on your own, and I can tell you why Part D may be so confusing. After this, it's less confusing because now they have a kind of visual on how Part D works throughout the year. So for more information about this or for additional practical resources, feel free to visit healthagentsnetwork.com.